Hi everybody, Beth from Long Island Concha Art Studio, here to talk to you today about Lyme disease and Zoloft. So, Lyme disease. I have had Lyme disease, or I was diagnosed with chronic Lyme about 4 years ago. It's about exactly 4 years ago that I had my initial chronic Lyme diagnoses, but I was sick for approximately 6 years before that diagnosis. And getting the diagnosis was difficult. It was really weird. I got to a point where I was so sick. I thought at one point I had cancer. That's how ill I was. And I thought for sure my body was riddled with cancer. And that I was going to go to the doctor and they were going to do tests and they were going to say, I'm sorry, you have like a month to live or whatever. You know, like I was absolutely convinced that I had cancer and I was going to die. Thank God I'm here. And that's not the case. I have Lyme disease, or that's what I was diagnosed with, as well as other things. And so I started the traditional treatment. I started with doxycycline, and of course had an allergic reaction, so went over to amoxicillin for a little bit, then we went back to the doxycycline, and I ended up doing that for 10 months. And the problem was is that, and in addition to the antibiotics, every time I would go for a follow-up, they kept adding more and more and more and more medicines to the Lyme protocol because I wasn't feeling better at all. And they would say, well, you're going to feel worse before you feel better, and I suffered some Herxheimer reactions, and it's just, and I feel like with Lyme disease, it's almost like whack-a-mole, like playing a game of whack-a-mole. One day, you wake up one day and you're like, oh, why are my eyes so red? This one eye, it's so red. Oh, I must have conjunctivitis. And so then, you finally, you get to the walk-in or you get to the doctor a couple days later and that's gone, but now you have something else. So then you're like, well, but now I have, and this went on for years. And those of you who are Lymies know what I'm talking about, or if you have any sort of, what is it called? I can't even find my words. But anyway, Lyme, chronic fatigue, Epstein-Barr, any of those sort of Crohn's, any of those things, autoimmune. That's what I'm looking for, autoimmune. I need to write that down. Anyway, so I had all these weird autoimmune responses, okay? And they can't really help you a lot in that regard. They don't have medicines for it. And basically, what you need to do, if you have Lyme disease, the number one problem of having Lyme is keeping the inflammation at bay. And that's the problem, right? So how can you do that? You can do that through, obviously, through what you're putting into your body, what foods you're eating, exercising, making positive choices, okay? And I would do all of those things. And I did all of it. I was and I am a really, really good patient because I'm not into being sick. I want to get better. I don't want to be a sick person. I want to be a healthy person, and that is, and it's ironic because the reason why I went on an antidepressant to begin with was it was explained to me after being sick and dealing with some really heavy stuff. My doctor said to me, well, let's put you on some Lexapro. It's this drug. It's very low, small amounts of serotonin. And it sounds to me really like you are missing serotonin. And so we just need to replace that serotonin. And once that serotonin is in your brain and you get, it's going to take a couple weeks, but once it starts working, you're going to feel really good. And you're going to feel like you'll feel much better. So I said, that sounds good to me. And sure enough, I followed up with him and I was like, this is a miracle. I felt so much better. I could not believe it took me so long. And it also was weird. It was wow, this is what everybody else feels like all the time. Because I had never had that experience. I've always been anxious and uptight and just nervous and just tight, like always just wound tight and anxiety and nervous. That's just been me. I've just been always, you know. And then when I went to Lexapro, I was able to like, exhale. Now it wasn't like I was on some sort of Valium. It wasn't like that. It was just like, oh, you know, and I could still feel my feelings. And, you know, I was aware of the side effects. And, you know, we discussed the side effects, and I didn't have any at the time. And there was a couple of things. I was like, yeah, I'll work through it. You know, it's fine. It's fine. It'll be fine. Because the benefit outweighed the negative. And then what happened was I switched over from Lexapro over to the Zoloft. And I didn't realize it at the time, but shortly thereafter, because I'd had such success with the Lexapro, and then when I went over to the Zoloft, it was seamless. There was no issues. I just didn't make the connection that I was suffering with lots of side effects, and not just common side effects, and not just mild side effects, but severe and rare side effects of Zoloft. And in fact, what I discovered while researching the other day, because I made a decision to take my health back, and, you know, having this Lyme diagnosis and having 10, 12 prescription medications in front of me, I was like, I'm not doing this anymore. Like, I can't take all this shit. There's no way all these prescription medications, because I'm not feeling better. It would be one thing if I was taking all those medications and I was feeling better, then I wouldn't have questioned it. But I was questioning it because I was taking all these medications and like it wasn't relieving my symptoms. It was not helping. It simply was not helping. And no one would help me. And the doctor's solution was, well, let's just amp that up. Like, let's add more medicine to it. No. And I started experiencing side effects from the medication. So I was like, I need to do something drastic here. I need to do something. You know, but how am I going to manage these symptoms? Because they're real. And the only medicine that was not up for elimination, there was only one, and that was my Zoloft. That was the only medicine that was not on my chopping block, so to speak. So anyway, I started, you know, I was as desperate as a dying could be, and I began using plant-based medicine to deal with my Lyme symptoms. And I had done a little bit of, you know, I did a lot of research on it and a lot of anecdotal evidence, some medical evidence. And a lot of times I like those anecdotal evidence because, you know, you look at a person, they're talking, you can kind of assess, like I'm sure you looked at me and listened to me speak, and you're going to decide whether you want to hear what I have to say or not. And you're going to say she's a whack job, or yeah, she's, you know, has something that I'm interested in hearing. And that's fine. Like everybody's like that. And I did the same thing with collecting my anecdotal evidence. And anyway, the anecdotal evidence I find fascinating because people are sharing. They have nothing to gain from it. Okay, people on YouTube, that we're not paid to say anything. We have no stake in the game, so to speak. Okay? And there's no conflict of interest. All right? But when you have medical websites or anyone who's a doctor, or who are they affiliated with? What's their stake? What's their spin? What are they trying to sell? What are they trying to make? What are they trying to gain? What are they trying to get? Unfortunately, as a patient now, this is the way we must approach modern medicine. If you have a chronic illness, you need to approach modern medicine very skeptically, because what I feel, and this is a feeling, it's not a fact, but I feel, this is my observations, again, these are not medical opinions, these are personal opinions, okay? But I just feel like, and this sounds conspiratorial, so that's why I'm hesitant to even let the word slip out of my mouth. But as a Lyme patient and as a person who was prescribed all this medication, now come to realize and find out today, or not today, 2 days ago, as I was doing research to get off of the Zoloft because I switched over to plant-based medicine. And once I incorporated the plant-based medicine, that allowed me to get rid of all those other prescription medications, the prescription medications that were on the chopping block. And I successfully got rid of all of them. Once I implemented the plant-based medicine and medical marijuana into my Lyme protocol, I got rid of my sleeping medication, I got rid of my anti-anxiety medication, I got rid of my anti-inflammatory medication, I got rid of a whole bunch of stuff. The only things presently right now that I'm taking, or actually I was taking, was my Zoloft and an allergy medication. Now the allergy medication is not on the chopping block because it is a short-term medication, I'm hoping. And so I finally had enough. I just wanted to see what I would feel like without being on the Zoloft, because it's been a really, really, really long time. So I started tapering. I have some experience with withdrawing and getting off medicines, and I have a high success rate. So I was like not nervous, and I'm still not nervous about getting off of it. But what I found funny was that when I tried getting answers as to how long it's going to take and how I should go about it, and you know, I had a really hard time finding information about that. Then I come to find, I'm like, well, what are the side effects of Zoloft? Like, what are they really? Like, because I saw a few, but I found this one website where they were listing even more and more. And then there were all these rare side effects. And I'm like, I forgot this and this and this and this and this and this. And oh my God, I even have this and this. These are the rare. I have these things. That's what that is. Mind blown. Not one medical doctor ever, and I've seen some really great doctors, no one ever said, wait a minute, let's just take a look and see, or let's get you down to, let's get you off of everything and then take it from there. No. In fact, even the doctor that helped me get my medical marijuana card actually suggested that I amp up the Zoloft, which I did for a short period of time. And then I started bringing it back down. And now I'm to the point where I just want to get off of it altogether because of the plant-based medicine, because cannabis is supposed to help alleviate and lift feelings of depression and melancholy. These are the reasons why I initially went on Zoloft. And it's weird, I was on the Zoloft, and the Zoloft made me clinically depressed. The Zoloft made me experience insomnia. In other words, I am discovering that the Zoloft, all of these side effects of Zoloft mimic Lyme disease. And I'm wondering, and I want to hear from you guys, anybody else have this experience? I'm not seeing anything on YouTube. Okay, and again, I'm busy, I got a life, I'm not in the medical profession, I'm not a medical person, I'm an art teacher. Okay, if you want to talk about art, I can give you some really sound advice, and you could pretty much rely on, I would say I am a professional. I'm a professional artist, I'm a teacher, okay? I know a thing or two about that, and with 100% assurity. But medicine, that's a practice, right? And so everyone's just practicing, it's a practice. They're practicing medicine, they don't really know for sure, and things evolve. And so the doctor that initially put me on the Zoloft was given information by the pharmaceutical companies that said that their medication helped patients who might have been born biologically shy of serotonin. And by taking this medication, this will help the patient to find balance and happiness and go on about their life. That's why my doctor suggested it. That's why I took it. Had I known now if I had known what I have now discovered, I would never, ever have put that in my body, ever. I never, ever, ever would have even put the first dose in. And now they're talking about, and this is on the down low too, and I will leave links in my description right below, so you can look at it yourself and do your own discovery if you'd like. Check up on what I'm saying. But they're even finding some information and discoveries are being made that Lexapro can even cause permanent brain damage. Permanent. They're not sure yet. So this is no joke, yet this is one of the top prescribed medications in the United States of America. It's just, I don't know. Well, I'm not a psychiatrist. I'm not a psychologist. I'm not a medical doctor. But that's an alarming statistic to me. Especially now within the past 2 years or so that they've discovered that the Zoloft really is very ineffective. It's not helping, as the numbers are not accurate. The drug information is not accurate. And here's another little factoid about Zoloft that might send you over. I know it almost sent me over the edge. Apparently, and I'm loosely paraphrasing here, this story goes that the Zoloft, first of all, the pharmaceutical companies hire medical teams to evaluate and test their product. And so one of the lead physicians who was running the clinical trial, then conveniently was placed in the FDA in a position to approve Zoloft going to market. Okay. No conflict of interest there. That's just one story. That's just one. That's not the only example of what and how the system is really, it needs to be completely dismantled. And I don't know what needs to be done, but we are in a crisis mode. So I almost wonder, it seems weird to me. Do they want us to be sick? Chronically ill, right? Because if they keep me on the Zoloft, if I go to a doctor tomorrow and my doctor says, listen, Beth, oh, no, stay on the Zoloft, I would continuously be ill. And then because I've done it before. I went off, I tried getting off all the medications, and then I would get sick. But the only thing I never went off was the Zoloft. So I would stay on the Zoloft, go off everything else, and then go back on everything else. And the only thing I never went off was the Zoloft. That is the only thing consistent in the entire time that I've been ill. And I just didn't put 2 and 2 together. I don't know. What's your experience with this medication? I'd love to hear. Positive, negative. Like I said, the Lexapro worked well for me. I had a seamless transition to the Zoloft, but it was shortly after starting the Zoloft that my health began to slowly deteriorate. Not alarming rate, very subtle, and nothing that was interconnected. And quite frankly, I just didn't look closer. I just didn't think that a medication that my doctor put me on would have so many adverse side effects, and that I would suffer from every single one of them, even the severe ones. So that's where I'm at, people. Let me know what you have. I'd love to hear from you. And I will be following this up, talking more specifically about topics pertaining to plant-based medicine, how to use plant-based medicine safely, and things like that. So thanks again for tuning in. I hope you enjoyed. I hope this helps bring some light or some clarity, or just makes you feel a little bit better knowing that you're not alone. That's all I have for today. Please be well and take care.